Good day, everyone. I am Jamela B. Sampulna of Arakan, Cotabato, Faculty of Cotabato Foundation, College of Science and Technology. The title of my study is Prevalence of Dengue virus infections among patients in Arakan, North Cotabato, Philippines. In recent years, it is observed that one of the dangerous diseases causing death of humans regardless of their age is dengue in all regions of the world. Dengue is a mosquito-borne viral disease that has rapidly spread in all regions of the world in recent years. Dengue virus is transmitted by female mosquitoes, mainly of the species Aedes aegypti and to a lesser extent Aedes albopictus. Aedes aegypti is the primary vector of dengue. Only species of the Aedes appear to be natural mosquito hosts for dengue viruses. World Health Organization data suggested that at least 100 countries are endemic of dengue virus transmission. About 3.5 billion people, 55% of the world's population living in tropical and subtropical regions are at risk, with about 50 million dengue virus infections occurring annually and approximately 500,000 requiring hospitalization annually. In the Philippines, Aedes aegypti and Aedes albopictus are the primary and secondary vectors. Recovery from infection by one provides lifelong immunity against that particular serotype. Infected symptomatic or asymptomatic humans are the main carriers and multipliers of the virus, serving as a source of the virus of uninfected mosquitoes. Estimated 59,943 cases between January and September 2014 with an incidence of 60 cases per 100,000. 65% of the cases in the country are admitted, while 55% are treated as outpatient. In Soxargen region, a total of 5,986 dengue cases are reported from January 1 to May 18, 2019, and 26 persons had died. North Cotabato has listed the most number of dengue cases with 2,215 compared with only 640 during the same period last 2018. It also has the highest number of fatalities at 11. This was despite of all the various efforts of the government and health sectors in the Philippines to eradicate the said disease. Thus, this study determined the prevalence of dengue fever in the municipality of Arakan, North Cotabato. The result of this study provide recommendation for organizational policies and treatment protocol. It is the main objective of the researcher to determine the prevalence of dengue virus infection among patients in Arakan, North Cotabato. 1. Identify the number of cases for the prevalence of dengue fever from 2015 to 2019. 2. Compare the prevalence of dengue fever cases from 2015 to 2019. 3. Determine the prevalence of dengue virus infection by age and gender. 4. Identify the barangay with most number of dengue virus cases in the municipality of Arakan. 5. Determine the month with the most number of dengue virus cases. This study was purposely conducted to determine the prevalence dengue virus infections among patients in Arakan, North Cotabato, Philippines. Benefiting the study are the various sectors as follows. Teachers. This study will serve as a guide and basis for some information related to the lessons. Students. This study will give them information about the prevalence of dengue virus infections with age and reaches its peak before adolescence. Community. It can provide true information not only to the population near at Arakan but also among persons with febrile illness would be an initial step in determining the extent of dengue infections. Policymakers. It can deliver effective communications and coordination to the government and non-government partners and the community to implement policies on adequate infection practices and improve vector control programs to reduce the dengue burden in the community. Researchers. This research can potentially serve as reference for future researchers that are interested to conduct further study on dengue virus. This quantitative study utilized descriptive survey and secondary data from Cotabato Provincial Epidemiology Surveillance Unit from January 2015 to August 2019. The researcher analyzed the surveillance data of notified dengue cases by determining the date of admissions, the age and gender of the admitted patients, and their barangay residence. Further, the researcher secured the permit to conduct the prevalence of dengue virus among patients from the Municipal Health Center and Municipal Epidemiology Surveillance Unit of the Municipality of Arakan, North Cotabato. In addition, the researcher utilized the percentage formula to determine the yearly prevalence of dengue fever cases from 2015 to 2019, and the percentage change formula to compare the prevalence of dengue fever cases in the previous years from 2015 to 2019. In Table 1, there were 786 cases of dengue fever reported from 2015 to August 2019 in Arakan, North Cotabato. The year 2016 has most reported cases with 198 with 25.19%, while 2017 had the least reported cases with 109 with 13.87%. From January 2019 to August 2019, the cases were reported to be at 165 with 20.99%. Based on the gathered data, the prevalence of dengue fever during 2015 cases was 14.7 higher compared to 2014. The 2016 cases increased by 50% compared to 2015. In 2017, the cases decreased 44.94%, while in 2018, it climbed up to 66.97% compared to the previous years as shown in Table 2. In terms of age and gender distribution, Figure 1 shows that most of the people who are infected by the dengue virus were females in the age group of 11 years old. The overrepresentation of females in other case series may reflect a stronger and thus pathological cellular immune response to dengue virus or a capillary endothelium more vulnerable to leak in females. Based on the result, out of 28 barangays in the municipality of Arakan from 2015 to 2019, the top 3 barangays reported with the highest prevalence of dengue fever cases were Malibat 1 with 164 total number of cases with 20.87%, Poblacion with 95 cases, 12.09%, and Santo Niño with 92 cases, 11.70%. The result further revealed that both barangays Culaman Valley and San Miguel registered 5 dengue fever cases each, with 0.64% and was reported to have less the cases of dengue fever. As shown on the Figure 3, most of the dengue cases were reported in the months of July, 17.94%, June, 15.14%, and May, 12.09%. It is reflected further that the risk of the dengue was significantly higher during the rainy seasons due to unnecessary collections of the water in the garbage containers and non-biodegradable plastics left outdoor, which favors mosquito breeding. Based on the result, it is concluded that 2016 had the highest dengue fever cases and that the year 2017 to 2018 recorded the highest increase in dengue virus infection cases. Prevalence of dengue fever cases were mostly recorded among females aging 11 to 20 years old. Barangay Malibatuan reported the greatest number of dengue cases from 2015 to 2019. The risk of the dengue was significantly higher during the rainy seasons. In addition, the public health impact of epidemic dengue fever is amplified because of lack of effective preventive measures, public health planning, and properly implemented emergency response plans. It is recommended that the government should allocate budget for public awareness on medical services and vector eradication efforts. Another is to establish sustainable dengue prevention program that is constantly monitored and evaluated. Further research should be directed on the circulating serotypes and their genotypes to help addressing the probabilities of dengue infection incidence in the future. That ends my presentation. Thank you so much, especially to iSorts for this great opportunity. God bless and have a nice day.